Welcome to the most multifaceted world of composite dentistry. This is our second webinar in the series of 6, and this is Bud Mopper again, speaking to actually the wall, but I'm speaking to you out there. If you didn't see the first webinar, I suggest you go back to it, because in that webinar I explained my concept of direct resin bonding and how the science of the materials affects the overall bonding result. The first presentation that I gave concerned itself with a class 4 restoration, and it was a large fracture. This is a very simple case. It's a small fracture. Like I told you before, no matter how big or how small, you need a definitive preparation. You never end at the lingual incisal line angle. I know it would be tempting to end there on this restoration, but you need a preparation on the lingual. Now I've got to make this match the other central, so we're doing our best to do that, and I think you can see we've got a very good match in this respect. But let's see how we got there. Of course, I did a long bevel on the labial, and what you're seeing is a modified chamfered reduction of about 0.5 of a millimeter all the way across the lingual surface. And that's what I would do in any case, and I'll take it as far as I need to. If it was a bigger fracture, I'd take it farther down the lingual surface. That's a judgment call on your part. But the thing about it is that you have to know is you need bulk on the lingual, and that's going to give you a resistant retention form. So you need to be, and no matter how, it could be a small little fracture, I always repair the lingual surface as I restore it. Now, in this case, this is a more recent case. I'm going to use enamel nano, and the tooth is lighter. Okay, so we don't know what's going to happen. Will I need opaque or will I not? We'll find out. So we're viewing this in the mirror, and as I'm sculpting it off, and I will use this is an 8A instrument. I think it's an IPC instrument, and it's a finite blade, so we can sculpt that very nicely on the lingual. And you notice the way it stands to attention when you place it and shape it. And now I'm going to shape it down the facial surface, and we'll transfer to an 8A blade, and we'll sculpt it, and I'll blend it over onto the labial. Now I've transferred to an IPC carver to try to refine my incisal edge. And we've got it blended pretty much the way we want. And in this particular instance, I shaped it and it got it exactly where I wanted. The third slide, I polymerized that material because I couldn't get it all sculpted on, so it still had to go in 2 layers on the facial surface because it's hard to get everything in one. I don't care what you use. It's hard to get everything in one layer. So what I did is put a second layer over on the labial surface and sculpted it exactly the way I wanted it. But do I need opaquer? I look at it, evaluate it. You don't. You see a perfect unison of color, gradual transition from incisal to labial and incisal to gingival, a gradual transition from incisal to gingival, and I don't need anything to block it out. So in this case, I'm not going to need opaquer. So we take a look from the occlusal, and you can see I've got plenty of room to add on my enamel layer. And what is it going to be in? It's going to be in microfill. I have the nano for strength and for opacity, which blocks out everything, and then I just lay on the enamel, the microfill. Sculpt it, shape it, get it where we want it. I could have tinted that area, but I didn't think it was necessary if I wanted to let the tint shine through. So we sculpt it, shape it, get it where we want it. Here we're using, again, I placed it on in one bulky piece, and usually it's a round ball, and I created it in my fingertips. Then I place it on the tooth surface, and I'll use it here. I'm using the broad-bladed instrument to compress that down on the tooth surface. And then we'll transfer to an 8A and transfer to an IPC to make the definitive moves to refine the margins. So you can see from one instrument to another, that gives me what I want. And as I place it, you'll see how I tip the instruments to make it blend down that tooth surface and sculpt off that excess. So it's a combination of two. Once I get the material where I want it, I polymerize it. Now if you take a look from the occlusal, it's almost perfect except in this area right here, in the mesial area where the embrasur's face is. So I need to add more material. That's all I need. The most important view of all the views that you use is the incisal or the occlusal view, because it sets up every aspect. As you look down in that mirror, it sets up the incisal gingival aspect, the mesial distal aspect, and the labial lingual aspect. So you know exactly where to put all the material to create the arch form that you want. Now, if you want a silhouette, one tooth against another, the best view, and we'll show you that, is from the profile. Rotating the patient's head so you can silhouette one to another so that you get a perfect arch form from anterior to posterior. So those two views are the perfect views. So I'm adding the material at the incisal edge. I'm going to sculpt it into shape, get it where we want it, using the different instrumentation, and you're going to do the instrumentation of your choice. The advantage of adding material with a rounded, more blunt instrument is that it slides over the tooth surface like spreading butter. The advantage of a sharper, almost scalpel-like blade, like the IPC instruments, is you can refine it anywhere you want it. You can refine your interproximal areas. You can take the material in underneath the free margin. You see, I do all this, and you'll see it when I do it much better when I'm doing things that involve the gingival margin. I do all this without retraction cord. I don't need retraction cord. If you want to use it, use it. I don't care. I don't need a rubber dam. I don't even want it in my way, because both those things get in my way as I'm trying to look at tooth surface, and it get in the way as I'm trying to produce what I want to produce. And I know the other factor is that this material actually, and if you take a look in the literature, it actually has a water repellent. It is a hydrophobic material as far as water is concerned. Not that I want to use it in a wet field, but I'm not worried about getting a little interclavicular fluid on it. So if we take a look after the material's on, we measure each tooth. I like this instrument. It's from Incisal. It measures within a hundredth of a millimeter, and it's a very small instrument, and it's a great instrument to use. There are other ones out there. Just know that you have to measure each tooth, because there is a difference in this tooth size, and you don't want a difference in tooth size. You want to get it as good as you can. All right. So again, from the incisal, if we drop down what I had speculated we're going to put on, you can see I've carved that pretty good. Look at the definition of the embrasure spaces. Look at the overall tooth size and the overall comparison of one tooth to another. Yes, you can see a little different in width, but as far as contour and shape and form, that's how close you can come with sculpting. You can probably even get it closer, but you want to leave a little bulk. So now we're ready to start this thing. Now, I use discs a lot. Where we find coarse discs are very helpful is in setting the incisal edge relationship from one tooth to another. You don't want to do that with medium, okay? I'll give you 3 areas where you use it. That's 1. Setting with the incisal edge from one tooth to another. 2, from shaping the facial aspect of the tooth surface. Very, very, you run it under slow speed and you've got complete control. It's great. And so I will also set the facial or the anterior-posterior relationship with the use of a disc on that facial surface at the incisal edge especially. Then you can find, once you've got the incisal edge set, you can actually do the same thing with the disc that you do with the burr as we described it. You angle it down towards the tooth surface and you cut out a different edge, and that's how you can recreate a curved surface. And you can start to refine the interproximals, but you can't refine them completely. You're just going to get the shape with them. You don't want to take it into the embrasure space because you're going to reduce the tooth too much. Okay. And the other thing you can use coarse discs, if you run them under from 10 to 7,000 RPMs, you can take out pits that you think you couldn't get out. And the way you tell if a pit is going to be, if you're going to have to fill a pit or you're going to get rid of it, is if you start it with like 2,000 RPMs and the pit starts to open up, you know you're going to have to fill it. If it starts to close down and you're into contour, chances are you're going to get rid of that pit with the disking, okay? So that coarse disc is key in the system. It is a key disc, and people underutilize it. Then you can go to your ET burr, which we're doing, which we did in the last one. You notice we're cutting as we cut towards the tip. We've got it tipped away from the burr, and it's going to start cutting down the tip, and towards the incisal edge, it's cutting in the middle away. Or as we get far, we want to rotate it back farther. You'll cut more towards the hub of the burr. On the lingual, it's the same OS1 burr, refining it to fit the lingual integrity of that tooth surface. Interproximal saw you can use. Sometimes we use that, or we use a method called torquing and placing in an interproximal strip. You just remember with an interproximal saw, if you have resistance, don't use it because you're going to break and chip things away. Then you use torquing in order to do that, or you have to take an 8392-016 and clear out that area. We'll talk about that as we go on. Okay. Now we're using an interproximal diamond strip. We have both wide and narrow strips, and we use narrow strips because if you take a wide strip too far beneath the gingival margin, you can sever the gingival attachment. You don't want to do that. The wide strip is for the wider interproximals. Now we're finishing with an aluminum oxide strip, or you can use Epitex followed by aluminum oxide strip, because aluminum oxide is going to polish it better than anything else. So we're following it up with aluminum oxide. Now, as far as the embrasure space, to further refine it, now we go into the embrasure space. You can see I've attacked the embrasure space from a perpendicular angle to the gingival, parallel to the line angles, into the embrasure space, flexed over the line angle. And you can see the flex. That's what you want to do. Okay? Now we can go to a rubber point, and you can see that with a little pressure, I've already put some characterization in that tooth surface. And I believe in subtle characterization. And the one thing you have to know is that even though you see lobes, and sometimes you'll see one lobe in a tooth, but usually there's two lobes in a central incisor, the lobe is always wider. The groove is always wider from the incisal, at the incisal edge than it is towards as you go toward the cervical. And I think you can see that narrowing down. It's sort of a triangular thing, a long triangle. What I tend to see so much is just two little scratch lines to replicate anatomy. That's not the way anatomy looks. You want a subtle transition between one lobe and another, and a gradual transition in the elevation of each lobe. So as we go to the lingual, we can do it with a cup. You might start with the core of the medium and finish it with a superfine. And the same thing is true on the labial. If you want a little more aggressive point, just remember it's more aggressive, so you might run it under lower speed. When you get to rubber, you always want to use the rubber points under copious amounts of water. Okay. Now we're going to measure it again. Once we measure it, hey, they're both 801. We're right on time. And then, if I want to put a higher polish on, I can even go back with the flexi disc, and the fine and the superfine do not cut; they only polish. So that's what you're going to do. So the two cutting parts of the disc are the coarse and the medium, and the polishing parts of the disc system are the fine and the superfine. So we go from fine to superfine. Notice the flex. We're just trying to bring up the polish. And then for the final result, and you really want to get a polish on it, we use enamelize. It's enamelized polishing paste, aluminum oxide polishing paste. We put a little dab on a Q-tip, use like Express It, in a dapping dish, and put it on a Q-tip on each tooth I want to be polished. We use the Flexi Buff, which is part of the Flexi Disc system, and it has a felt front on a mylar back. We use it with pressure and between 10,000 and 15,000 RPMs, and we polish it, and you will see the kind of polish that we get, and you can see the blend of that restoration to tooth surface, and I defy you to find a margin and a demarcation. And that's the way every Class 4 restorative should look, and that's the way every restoration should look. Really, the main purpose of webinar 2 is to show you again how valuable composite resin is, not only from the sense that it can be used for routine restorations aesthetically, such as cervical restorations, or as reinforcement of the incisal edges, which we're going to show you after this, but how beautiful it is when they're done properly. Now, when I'm talking about cervical restorations, I'm talking about cervical restorations of all kinds, whether they be restorative in nature because of decay or something like that, or that they're erosive in nature. Whatever it is, the one thing I want to do is get them to disappear into tooth surface, as you can see in the before and after, so that you can't find them. So that takes into consideration color, that takes into consideration how you polish, that takes into consideration where you end this material on the tooth surface. It takes into consideration where you end this material at the gingival margin, which is beneath the pregingival margin in this case. So all these things we're going to discuss as we go through the technique of how we get this result you're looking on the right-hand side of your screen. So if we take a look at these restorations, really hardly involving the dentin. Now, when they don't involve the dentin, we don't necessarily have to use a dentin material. And our preps are kept to a minimum, of course. There's no decay remove or anything else like that. So all we're going to do is roughen up that sclerotic zone. And to do that, we're going to roughen the sclerotic zone with this pear-shaped micro diamond, which is beautiful because it gives us great access. Micro diamonds are great. The ones I use are by Brasler. There are other ones out there, but I use a medium grit diamond. And all I do is just gently run it at about 5 to 10,000 RPMs under copious amounts of water, just enough to remove the sclerotic zone. Then we'll transfer to a flame shake diamond to take the margin beneath the free gingival margin so that we end up in an aesthetic zone. I don't want to be able to see that margin, and if you take it beneath the free margin and you have the ability to marginate it properly, it will not do that, and you actually will maintain the viability of the gingival tissue. So this flame shake burr is great for doing that. Then we transfer the 6862 diamond, which is a bigger flame shake diamond, and that's going to create our long bevel. We always talked about long bevel on the class 4. The same thing is true here. And there you can see the extent of our long bevel. How long is it? 2 or 3 millimeters, long enough to do the job. Basically, my length here, and what I consider is, I want to bring it up basically to the height to contour of that tooth, because that's the easiest place to finish it and polish and develop the proper convexity of the tooth surface. So now you can see the way it looks, and it's really a minimal prep. It's nice and clean. It's easy. There's not much material we have to add on. What are we adding on here, basically? The enamel surface. What are we going to use to replace the enamel surface? I told you, when you replace enamel I told you this before, you're going to think of microfill. And especially in this case, because not only will microfill block out in this case and give you a beautiful result, but it has the flex that you want so that you won't lose these restorations. Now, if you want to make retention areas in these because you don't feel safe with it, you can do that. It's not going to hurt anything. But in this particular instance, I found it that we just don't have to. And once we've done this, now we can have done our prep. Now we can isolate, acid etch, which we have done in the enamel, and acid etch the dentin. And the way we do it is we will apply the acid on the enamel and then on the dentin and let the whole thing set for about 30 seconds. That makes sure that you got a proper etch on the enamel and the dentin at the same time. Put on our bonding adhesive, air thin it. In this case, I'm using the dentin primer. In our case, we're using Cosmodent Complete, but any of your bonding agents are great. Okay, I still would suggest some type of 4th, 5th generation bonding agent. In this case, it's a dentin primer that has both the primer and the adhesive in it. Air thin it, polymerize it, and then I'm ready to go ahead with the rest of the restoration. Now, here you see me using flowable material. You don't necessarily need to use flowable. Why do I use flowable down in that area? To slightly underfill it. The reason for that I do this, and I use a flowable microfill, the same color of the material we're going to use. The reason I do this is only a slight amount because it's easier to sculpt the next layer onto that tooth surface, the paste material onto the tooth surface. But you don't have to. You can use the paste material by itself if you want to. This is the way I opt to go, and I think it's very good. If you look at that, there's still a concavity in there. See that ultra thin layer, but that is going to make it much easier, and I polymerize that for about 20 seconds, and that's going to make it much easier for me to put on the next layer of material. So that's why I use a flowable. Do you have to use it? No, you don't have to use it. So the next thing is the application of enamel microfill. And why only microfill? I told you before. That's all you replace is the enamel surface. So that's all you need because we built in the natural opacity of that enamel. You can see us placing the paste microfill, sculpting it. We'll place it with a blotter blade instrument, then transfer to our IPC, shape it, form it, get it where we want it, and polymerize it. Now, for me, everybody has always said, well, how do you make sure that the margin's closed? How do you know? Because it is true. Microfill does shrink more than any other material. So how do you know that margin is closed? Well, I don't know that margin's closed, but I always have made sure at the gingival that I've always closed the gingival margin down by adding, after my first polymerization of 20 seconds on the original paste microfill, I take another ellipse of microfill, roll it in sort of a hot dog shape or a cylindrical shape, and I place it at the gingival. I gently start to place it and condense it, if you will, against the margin and down beneath the free margin. Using these ultra thin bladed IPC instruments, you can go right beneath the free margin. Now you will notice I have no retraction cord in there. The reason I don't use retraction cord is it gets in my way. I don't want to have the retraction cord impinging on my instrumentation. But if you want to use a retraction cord, my partner uses it, that's fine. My whole thing is I want the patient's tissue in impeccable condition so I can work with ease and I don't have to place retraction cord. Because I think retraction cord creates other problems. But that's, again, that is the operator's option. So I'm doing this without retraction cord. And you see I've got that very nicely sculpted. And you can see the shape of it. You can see the contour, the convexity, how it moves in towards the gingival, how we sculpted completely towards on the proximal surfaces so that there's no excesses. Because having excesses makes polishing difficult. If you sculpt so you don't have excesses and maybe just slightly overbulk on the facial surface, it's much better for you. It makes polishing much easier. So once we've got this in place, like this, we can polymerize these materials, as I said before, in 20-second increments, but the final polymerization we think should be 60 seconds. And what's nice about this is you can work in quadrants in this type of dentistry because you don't have any proximal surfaces that you're worrying about. And I don't want to finish one and cause bleeding, so I will do this in quadrants. And now you can see I've got all three of them sculpted, shaped, formed, and ready to polish. And the thing about it is, if you take a look at this picture, you can see how accurately sculpted to detail I have. And you can see the curvature of the tooth surface as it runs up the tooth surface. That's what and so if anybody were to ask me again, what's the most important aspect of doing bonding, it's the application and sculpting. It makes everything easier all the way down the line and prevents a lot of problems from occurring. So this is the way it should look. And from this point, it's just finishing and polishing. So we do this, it's all the same thing. You can start at the occlusal surface with a disc if you want to, but usually I start towards the occlusal with an ET burr, running it from down the facial surface at the angle of the convexity, and then I will tip it down towards the gingival, and I'll run it at the angle of the convexity at the gingival. Then when I go back to the occlusal margin, or that's the occlusal margin, but it's not on the occlusal, it's on the facial, and I'll use a disc because you need a disc to blend it into the margin. You're not going to get it in there with rubber. It's not going to disappear with rubber. You need a disc, and the disc you need is the coarse disc. And the beauty of this FlexiDisc coarse disc is that it does not leave scratches, and you can blend it right into tooth surface. After that, you can follow it up with medium, fine, super fine, and then follow up with your enamelized polishing paste like we showed you before. And it's all a series of step down. It's like polishing metal. You step from one grit to another, from coarser to finer, but you want to make sure your coarse is not extra coarse because you can't get the scratches out. That's the beauty of this system. So this is the way we started with the cervical restorations that this patient wanted, okay? And this is the way we finished. And that happens to be 1 year post-op. And I want you to look at the gingival tissue and the health of the gingival tissue, the contours, the shape, the blend into tooth surface. And that's the way cervical restorations should look. Now in this particular instance, this is cervical restorations of a restorative nature. The reason it's restorative is because this patient came into me after having braces, and you can see the decalcification and the caries that have developed on that kid underneath the braces. Now you see this all the time. Or it wouldn't make any difference whether it was just a case of decay or something like this. But in essence, when they come in like this, you want to make these restorations again disappear to tooth structure. When we prep them, you will notice that they are much deeper. Here I'm into dentin. That's the difference, okay? But if you take a look at the preps, I've got a bevel, a long bevel, a deep prep, and I'm going to do exactly the same thing. The only difference is in those areas of depth, I'm either going to put the nanofill or the microhybrid, and usually today I'm using the nanofill because the nanofill brings up the opacity, keeping the color the same as the surface color. The nanofill will bring up the opacity, And then you can overlay entirely with the microfill. And once you do that and you polish it, you end up with something like this. And you take a disaster and something that, in this particular case, which was an ortho case that they paid a lot of money for, and you take the braces off, and the parent and the patient are horrified, and you turn it into something that you'd never know there was a problem. And this is what you're trying to do with cervical restorations. But without the use of microfill, it's not going to happen. If you take a look at this case, this is a person, again, who's had a series of, I think in the bicuspid and the lateral incisor, this patient has had old restorations placed. And in the lateral, there's erosion. Maybe there was an old restoration there. But we're going to make these disappear again, and we're going to show you how to do this with the use of a video. And it gives you the real-life look of what we're really trying to do. So, if we take a look at this, here you see, there's the use of the pear-shaped diamond, and it has diamond up the hub so you can actually start to form the bevel too at the same time. And all I'm doing is just roughing it up, just sort of feather touching it, just to give it the type of prep that I need. Now I'm going on tooth to tooth. I think I'm preparing 3 teeth in this particular instance. And now we're transferred to the flame-shaped burr and refining the margin and taking it slightly beneath the free gingival margin. And we're starting to bring it up even on the long bevel with that burr. But I can't make the bevel the way I want it with that smaller flame-shaped burr, and so we'll change to a 6862 flame shape. And that will give me the bevel that I want. So running underwater, just gently, and I'm just sort of feather touching it. And I'm running it at about 20,000 RPMs when I get up to make the bevel. Wash it thoroughly, dry it. What I'm doing here is I'm making sure I take that margin in the interproximal far enough to hide all the margins. Now we're just checking everything. Now I've got the mylar strips in place, and I'm going to place the first series of material. And after acid etching and thorough drying, we put on our bonding agent. We put on 3 coats of bonding agent, then we air thin it, and polymerize it. And down goes the flowable. Notice, just off the tip, and I use the smallest tip I can find, just off the tip, just a slightly underfill. When you take a look at it, that's with the material in place, slightly underfilled. Now we're ready to place the bulk enamel, the paste enamel, sculpt it gently underneath the free margin, blend it up onto tooth surface. Now that I've placed the material, I will polymerize it for about 20 seconds, and that will allow me easy placement of the ellipse of material that's going to close the cervical margin, because I can sculpt it very easily against the pre-polymerized material and make sure that margin is completely closed beneath the free gingival margin. You can see how gingerly, how lightly I touch it. Now we're using interproximal finishing strips to make sure that the interproximals are finished in this case. And the reason I make sure that the interproximals are finished in this particular tooth is I want to make sure that they're finished completely so that I can restore the other teeth prior to finishing each tooth completely. Then I can do the complete finishing all together, and it'll make polishing perfect for us. Now we got them all restored, and we're doing our finishing techniques. You can see this is the use of the ET. And I'm using it dry in this particular. You can use it wet or dry. It's not going to hurt the tooth or anything. Now I'm taking it underneath the free margin, and she will run a water drop on that when I do it, or you can use water out of the handpiece. And I have her use a water drop, and she just squirts a little water on there while she's doing it. And now I'm towards the incisal in this particular, and towards the occlusal margin. I'm using a coarse disc to get that blended into the tooth surface, followed by the medium, fine, and super fine. And now we're finishing it up with our polishing paste. That's the aluminum oxide polishing paste. And that's the use of the Flexi Buff, which is the buffing disc. With flex, you can see the disc flex, and you can see the polish come up. And you can see the characterization that I followed in the tooth surface, and the reflection of the reflectivity of the material. And that's what you want to see, and the color blend. All right, the second part of this webinar, I told you, was going to be incisal reinforcement. What are we talking about here? We're talking about incisal wear. If you take a look at the lower right canine, you can see the wear we're talking about. And this is what we see so many times. Well, there's certain things you have to consider. What's causing the wear? What do you do after you've restored it? Do you place a patient in a night guard? Do you have to replicate canine rise? Because if they're not, they're in group function and they're still going to brux and you're still going to have a problem. What are you going to do? Well, in this particular instance, in this case, I did restore canine rise because I thought it was important to do that, to give the patient a functional occlusion in excursive movements. And I thought that would help prevent the wear. But also, when we finished the case, we did put the patient in a night guard. But if you take a look at the other teeth, they've already been prepared. And it's a very simple technique, and it's used with the burrs that we talked about. What I do in the preparation is I enter the incisal edge with the small flame-shaped microburr that we've shown in the past at the cervical, and the tip of that burr allows us to penetrate into the dentin. And then I will widen it out with a burr that's the same size, only it's a straight fissure burr with a rounded end, basically, is what it is, of the same size, just to broaden the base. And that's why you get those clean, neat preps on the incisal edges. But you must run it under copious amounts of water at about 20,000 RPMs. 28,000 RPMs, I think, is a speed that's really great. I use copious amounts of water because I don't want those walls to break. And if you look, we've got intact mesial, distal, labial, and lingual walls of enamel, and that's what we want to preserve. And I'm not adding length to these anterior teeth because we don't need to, okay? The only place I'm adding length is to the canine because it's lost the length. Right? So that's what we're going to do. So that's our preparation. Well, let's show you the preparation. This is the microburr that we talked about to broaden the base. If you notice, when I talked about penetration, you can see that tapered burr, which is that tapered flame-shaped burr. That's the burr that we penetrate with in order to get into the dentin. And the burr on the right-hand side of your screen is the straight burr with a rounded tip that broadens the base. Okay, so now we've got the use of both burrs doing what we need to do, and we've done it on the bicuspids, and we're also doing it on the opposing bicuspid. Now we're ready to go ahead and restore these. Now another thing is that we can do these in quadrants. I opted in this particular instance to do the laterals and the centrals together and then the cuspids by themselves. The thing I use to isolate these four teeth with are sort of a metal strip. The reason I use metal is because metal is thinner than mylar. It's very hard to get 4 mylar strips in there. For me, it's easier to get metal. But you got to isolate with something because you don't want to etch the proximal surfaces of these teeth. Okay, so we go ahead and we place it. Now you can etch it all of them at the same time, which I did. I'm using 37% phosphoric acid. We leave it on for actually when we etch, we want to leave it on the enamel for 30 seconds and on the dentin for about 20 seconds, and that's about what we do. Then we go ahead and we wash it off, dry it, air it in it, place our bonding agent the way you're supposed to according to your manufacturer's instructions, and I place it the way I want to. I usually put on 3 real quick coats of the Denton enamel primer, air thin the whole thing, and that's the way it looks when the bonding adhesive has been placed. Should have that nice shiny appearance. Take a look at it under higher power. That's been air thin. It's got a nice shiny appearance. We know we're going to get a good bond. So what's our next move? Well, we are into Denton in depth. So my next move is to place Renamel Nano. That's what I'm going to use as the Denton replacement. It is the same color of the material that I'm going to overlay it with, which is going to be the microfill, which is going to replicate the enamel surface. Both in composition, both in structure, both in aesthetics, and for wear factors. So the first layer that goes in for opacity, to block out any translucent shine through, is the Nano. Place it, thin it out, and blend it and get it off the incisal edges using your instrumentation of whichever ones you want. You could transfer it to your IPC to make sure you get everything off the enamel edge areas that you want. Then we're going to make a concavity with the multi-purpose instrument. Titanium coated, we're going to thin that out and leave enough room for what? The microfill, which is going to replicate the enamel surface, and you don't need a lot. Okay? So, next is the application of the microfill. First you polymerize this for about 20 seconds, then you overlay with the enamel microfill. You can add on with a broader bladed instrument, sculpt it, shape it, get it the way you want it. Go to your IPC, make sure your proximals are clean and neat, and you can do all 4 before you polish. Just making sure that those proximal surfaces are clean. Once you're done with that, you can polish all 4 at the same time. And we can pick up interferences. We will use articulating paper of different grits, different thicknesses. Here's the heavier paper that I usually start with, and I follow up with the AccuFilm. So we're using the heavier paper, and we'll start with the coarse disc, and we'll take off the excesses where we see them, starting to smooth it down. Then we'll transfer to the medium grit, to the fine, the super fine, and then we can even use rubber just to make sure there's no excesses on the facial and towards the lingual. In the interproximal, we start with our interproximal diamond strips and follow up with aluminum oxide finishing strips, and then we'll check with our AccuFilm. And you can see on the lower right lateral incisor, patient's lower right lateral incisor, there's an interference on that material, and the patient feels it. You can also see it a little bit on the patient's lower right central, but if you take a look over on the left central, that's all on enamel. It's not on material. So I can see with the use of the AccuFilm when they go into protrusive, okay, where I need the excesses to be taken off. So we'll take the excesses off, finish and polish the way we want it, and that's the way it looks. And you go through with your polishing paste, and this is the way it looks from the facial view. And see the beautiful transition of the incisal edge into the restorative. You can actually see the canine rise that we put on both both cuspids. That's going to give them the disclusion they need. And this is the way it looks from the incisal. And this is just another case where 14 years ago I had done some veneers on this patient, and he came in and he had incisal wear, and I hadn't seen him for quite a while, and even in this particular instance I ended up with something that looked like this. Completely invisible restorations, incisal reinforcement. And I got this patient back into really good shape with totally minimally invasive restorations. So, again, you've seen an animated aspect of it. Let's take a look at it on the actual video. Here we have a patient with excessive incisal wear. Not the greatest color teeth in the world. He wasn't interested in the color change, and so we're doing the same thing. Again, you can see the entrance of the burr, how nicely it trims and sculpts away that excess material. That's the flame-shaped diamond. How beautifully it works and penetrates. Running at 20,000 RPMs under copious amounts of water. Then we'll follow that up with the straight burr. is what we're doing here. You can see that. Just broadening out the base. Now we're placing the metal strips in between these teeth, and there's a lot of them to separate. You can see the metal strips are in place. All it's there for is to protect from etching the sides of each tooth. Now I can etch each tooth individually without worrying about the teeth sticking together, okay? Because we don't get etches on the side of the teeth. Now we're washing off the acid after the proper length of time. And now we're air drying them. We want to see a good quality of etch. Now we're placing our bonding adhesive. I use a brush in areas like this. You can use anything you want, but I find that the real small brush works very nicely in incisal reinforcement. Now once we've done that, now it's got the placement of the nano. And you can see I'm using the tip of the blade to try to pack it into place and get it down into the depth of it. And now I'm going to remove the excesses that are on there. But I want to make sure the material is down there and densely placed. And then, using the multi-purpose, I am creating the concavity to allow for the proper thickness of microfilm. Once I've done that, I polymerize it, and now you can see me placing the layer of microfilm. And I will do all 4 teeth, one after another, before polishing them. Here I'm using the IPC blade. That's what's so neat about it, just to sculpt out the excesses, because you can't get it off with a thick blade. So this is almost like a razor blade, and it takes out the. You see how nicely it trims these incisal edges. Then my final cure again is 60 seconds. Now we're going through the finishing technique exactly the way we described it. In this particular instance, we don't need a rotary burr because we're on the incisal edges. So we all just think about that. So we're only using the disc. And in this case, it's the coarse disc, which is taking off the excess, which is going to smooth off the tooth and get it perfectly with no scratches. If you use a rotary instrument on that top, it would be hard to control it. But since this is a flat surface, the disc works perfectly. And now we're using the medium and going through the grit system to fine and superfine. And prior to using the aluminum oxide strips, we would use a diamond strip. And now we're using the aluminum oxide strips to finish off the proximal surface. You can either use that or Epitex or a combination of the two. And that is incisal edge reinforcement, ladies and gentlemen. And that's the way we do it. And it's been very successful for us. And then, if the patient is an excessive bruxer, you must put them in a night guard. If they won't, then they go at their own risk, as far as I'm concerned. What you do is your business, but you can't be responsible if a person is going to keep grinding. You got to have some way to stop them. Now, whether they're a grinder, what's the cause? Is it tension? Is it this? Is it sleep apnea? That's something that you have to figure out. Again, thank you for watching this second webinar. I'm probably having more fun doing this than you are watching it. It's a pleasure for me to try and describe the techniques that I've used all these years in detail and the reasons why. I think the reasons why are just as important as the technique, because there's a reason behind everything that I do. So I appreciate your attention, and I look forward to the next webinar.